Connections. I'm your host, Tobias Pugsley, and today I have a really special guest, Dr. Tom Foster with the Hensley Behavioral Health Center. So stick right with us. We'll be right back. Welcome back to Healthy Connections. I'm your host, Tobias Pugsley, and today with me, very special guest, Dr. Tom Foster. Dr. Foster, welcome to Healthy Connections.
Thank you, Tobias.
Thanks for being here. This is a community show where we let everybody in the community kind of know what's going on at the hospital. And this month, a lot of exciting things going on in behavioral health. So before we get into that, why don't you start by telling us how you found this jewel known as Mountain Home?
Sure. Well, I'm Dr. Tom Foster, and I'm a geriatric psychiatrist. I've been in Mountain Home for about 3 years now. My wife is a native of Mountain Home, and so that's really what brought me back here. I'm from North Little Rock originally, so not too far.
Yeah. Little Rock's a little bit of different area than North Central Arkansas.
It's definitely a little bit different than I was used to growing up anyway, but it's beautiful here, and I think we've really enjoyed our years here so far.
Y'all get to take advantage of the rivers and the lakes and all the things the Mountain Home has to offer.
Yeah, absolutely. We spent a lot of time on the lake and in the water, so.
That's excellent. So tell me a little bit about your experience with Baxter Regional. You've been there 3 years now, right? Is that correct?
Just about 3 years.
About 3 years. So tell me about that and how that's been going the last 3 years.
I think it's been going pretty well. I did a fellowship in geriatric psychiatry and then straight to Baxter Regional. And so I've been the medical director of the Hensley Behavioral Health Center for these 3 years, and I think it's been great.
Wow. So what kind of services does Hensley Behavioral Health Unit offer up there? What type of treatments do you all do, and what kind of patients do you deal with?
Sure. So we're a geriatric inpatient psychiatry unit. So we treat a variety of diagnoses, things like dementia with behavioral disturbance. We also treat people with severe depression and severe anxiety. And it's a short-term treatment unit, but we do treat a variety of different types of patients.
And so I'm assuming geriatric, they have to be over a certain age. Is that what 50 plus?
Yeah, 55 generally is our cutoff. Occasionally we'll make exceptions if someone has a very early onset dementia, for instance, but generally 55 and up is our age range, which is loosely defined geriatrics, I guess.
Gotcha. So talk to me a little bit about the types of depression that you see in seniors in this area. I mean, obviously Mountain Home's a retirement community. We do have a lot of seniors. We want to make sure that mentally they're able to stay healthy. But what types of depression are you seeing, and then what loss of loved ones? What types of things are you seeing?
So I think there's a variety of things that can some sort of trigger the depression, if that's kind of what you're getting at. And like you said, grief is often a big one that we see in a lot of people. I think in the younger folks, a lot of times it's a struggle, sort of retirement and moving to a new place. A lot of people obviously retire here, and trying to reestablish your life in a new place can be very challenging for people. And so it's a variety of presentations that people have in terms of what might trigger the depression. But we help. It doesn't really matter what triggers it. We can help with it.
Excellent. Yeah, I can imagine some of our seniors that move here from all over the country, and that just being such a change for them too, and maybe not focusing so much on the trigger specifically, but it's nice to know that Baxter Regional has the resources, yourself, your staff up there at Hensley, to be able to help them cope with some of these issues.
Absolutely.
For somebody out there that might be a potential patient watching, if they feel like they're starting to feel a little more sad, or they're starting to see signs of depression, what's the first step? What do they do?
So I think the first step for most people is to probably talk to your primary care doctor. And they're a lot of times the best first approach to sort of see how bad the depression is, and if you need any further treatment aside from your primary care doctor, a lot of times they'll go ahead and do the referral to our unit if people's depression is that severe. The majority of depression can be treated in the outpatient clinic. It doesn't necessarily need to be treated in an inpatient psychiatry unit. That's really limited for the very severe cases. But the primary care doc's usually the first stop for people.
Do you have any advice for our viewers out there for any kind of preventative? Is there anything that you can do to maybe not necessarily prevent depression, but maybe help cope with some of those things? Maybe you got any?
So I think a couple of things come to mind. One of those being trying to stay engaged as much as possible, in your social groups, in your community, trying to stay active as much as possible. It can be challenging as you get older depending on your physical limitations, but trying to do as much as you can. I think that's very important. And also exercise can also help a lot with depression and prevention of depression. And so those are kind of, good things for everyone to do. I mean, everyone should be exercising anyway, but it can also help prevent depression.
Absolutely. Well, that's, we have the volunteer program at the hospital,
Right.
and obviously if somebody's new to the area and they're looking for opportunities to get involved with something, we have over 500 volunteers at our hospital, so that's a great place to meet people, get involved. As part of that, you also get the free membership to the
Yeah.
the Knox Wellness Center to be able to exercise. So
Yeah.
we really kind of offer it all for anybody.
Absolutely. And it's a great program. I think I've referred many people to the volunteers, and I think any kind of volunteering, you don't have to do it at the hospital necessarily, but that's a great way to stay engaged in the community and stay active and maintain those social connections.
Absolutely. There's so many good organizations in this community that need volunteers and use volunteers, and I'd definitely say there's not a shortage of volunteer opportunities.
Right.
It's just getting plugged into what your passion is, and that makes a big difference. You see a big difference in patients with that.
Absolutely.
So talk to me a little bit. I know that September is Suicide Prevention Awareness Month, and that's something that no family wants to ever have to deal with. But bringing awareness to that, and so the families are aware of it. Can you talk to us a little bit about that this month and what that means?
So it's Suicide Prevention Awareness Month, as you said, and I think the goal, is just to try and raise awareness that suicide is a big problem out there, and it's definitely a big problem in our area, in our county, and in our state. And I think, kind of to open the discussion with people is the main idea. I think there's a lot of shame and guilt around people with depression and mental illness in general, but suicidal thoughts, people a lot of times don't want to talk about them. And so I think just making that first step to kind of talk to people and ask them if you think that they might be having suicidal thoughts, to go ahead and ask them about it and make it an open discussion and not something that's necessarily shameful. And that's kind of what we're trying to raise awareness for with the month.
All right. It seems like the more opportunities they have to talk about those things and finding somebody to confide in, it seems like a crucial piece.
Absolutely, yeah.
And that's so all month long, the whole month of September is Suicide Prevention Awareness Month. So make sure you talk to your loved ones and have those conversations and know that they have somebody that they can turn to and speak to, and if that ever becomes an issue. Something we're doing, I heard a big event coming up in October.
Yeah.
That Hensley's putting on. You're going to lead some discussion. You want to tell us a little bit about that?
Sure. So the event's October 5th, and it's going to be a lunch talk. We're going to be free lunch. I'm going to be doing a talk on depression in the elderly, or in older adults, I should say. And hopefully it's going to be a good event. I bet we're going to have a good turnout, and it's going to be hopefully informative for our patients and their families. It's going to be, I think it's the day after National Depression Screening Day. And so if people are interested, we're going to be talking about depression screening as well as treatment and demographics in the elderly.
Y'all actually be doing the depression screenings there on
Yeah,
site?
so
during the...
if people are interested in being screened, there will be some screening available there.
Wow. What a great event.
Yeah.
And that's going to be in the Lagerboard Dining Room?
Right
Next to the cafeteria, right on the campus of BRMC.
Yep.
And anybody's welcomed, whether you're the senior, whether you're a caretaker,
Sure,
a family
right,
member,
right.
Somebody concerned. You're going to be talking about some great things, it sounds like.
Or if you're just hungry.
Yeah, if you're just hungry, want to there will be lunch provided. And how does somebody sign up for that?
Well, we just need to know how many people are going to come. So if they could give us a call and just give us their name and how many people are coming, so we'll make sure we have enough food for everyone. It's 870-508-6400, and that's the number to the Hensley Behavioral Health Center.
And then call there and just let them know how many people they're
Yep.
bringing, and
Yep.
it should be a great turnout. We can't wait. That's going to be exciting. A great opportunity for those in the community. If you want to learn more about depression and see what type of screening is available, come to that. Hear Dr. Foster speak about depression and how that affects the family, And really looking forward to that. Hopefully get a good attendance. So make sure to mark your calendars for that date. And with that, we're going to take a quick break. We'll be right back after these few messages from our sponsors. Welcome back to Healthy Connections. Again, we're visiting today with Dr. Foster at the Hensley Behavioral Health Center. And Dr. Foster, we've talked about the events and things coming up, but let's talk a little bit about something that's also really prevalent in our area, and that's dementia. Do you see a lot of dementia up at Hensley?
We sure do. Yeah, that's one of the main problems that we treat up there.
Really? What types of dementia are you seeing, and what are some strategies that you're using to help patients cope with dementia?
Mm-hmm. So the most common type of dementia is Alzheimer's disease, and that's the most common type of dementia that we see and treat. For the most part, we're not treating the dementia itself. For the most part, we're treating the behavioral symptoms related to the dementia. And so that can be things like agitation or hallucinations, sometimes paranoia, restlessness, these sorts of problems that people have when they have the dementia, not necessarily the memory problems per se, or what we're helping people with.
And is that done with medication? Is that done with talk therapy? What are some of the different types of, how are you treating it?
Typically, we treat the behavioral symptoms with medications, and there's a variety of different medicines just depending on how severe they are and what specific symptoms people are having. But usually the medications are needed to help with those symptoms.
Is it kind of does the patient try a few different ones and then kind of finds what works best for them, and then you tailor that to their need?
Right. So I mean, it's always individualized, right? So you try a medication and you see how they tolerate it, and if it's effective, and if it's not, then you try something else. Sometimes we get it right on the first shot, and sometimes it takes a few different tries to see what'll work for people.
If I'm a family member out there with dementia, and I'm a family member that has a loved one suffering from dementia, I know a lot of times that can be extremely stressful, especially if I'm in a caregiving capacity. Do you have any tips or any ideas for those caregivers and how to cope with that stress?
Mm-hmm. So that's a huge problem that we see in the families of our patients. A lot of times there's a variety of caregivers, but sometimes there's just one. A lot of times we'll see the spouse as the only caregiver with very little support at home. And when you have a loved one with severe dementia and behavioral symptoms in particular, that can be extremely stressful. It's a 24-hour job taking care of your family member. So I guess the main tip that I have is to reach out for help when you need it. I think a lot of times people don't reach out for help. They don't have any supports at home. They don't have any family nearby. And so, even if it's just for a couple hours a day, look into getting an aide in the home, look into, taking care of yourself as well. A lot of times these caregivers end up not taking good care of themselves from a health perspective. And then another good support is the caregiver support group at the Muruck Center, the Muruck House. I think it's every third Wednesday, but I think it's on the calendar on the website, so I think they could probably see when it is. I think it's on a Wednesday. But anyway, the caregiver support group is a great resource too, because there's a lot of people struggling with this that are going through the same sort of problems.
I've heard a lot of good things about the caregiver support group and a lot of the people that it's impacted, because I think that's kind of our heart typically. If we're taking care of somebody, we want to take, and spend all of our time and resources and efforts and take care of that person, and oftentimes it seems like we forget about ourselves.
Absolutely.
And so in that caregiver supports, they obviously talk about some of those different things, and then you're kind of in a facilitated environment where they, something that this caregiver may be dealing with, maybe I'm dealing with as well, and maybe it really helps address some of those things. The Muruck Center obviously provides a tremendous amount of support for the community.
Yeah,
and
it's a great resource.
A great resource for anybody taking care of a patient with dementia or Alzheimer's. And so that's a great place to start, right? If you have a loved one that's dealing with some of that, you start there. They have a lot of great resources, and I know that caregiver stress can become a serious issue, right? I mean, I've even heard stories of patients that were caregivers that were hospitalized
Right.
because of
Yeah.
really not taking care of
Yeah.
themselves. So that's your big point of advice there, is they really just need to also take care of themselves
Right.
and seek that. That's excellent. Well, is there anything else today that I've not covered that you'd like to talk to our viewers about?
I think we talked about most everything, I think.
Yeah. And if they have anybody that a loved one that geriatric 55 plus, that they should obviously have those conversations with their PCP before.
Sure. Yeah, so the most common way that we see folks is through the primary care doctors or through the emergency room. But it's a lot easier if you can get in to see your primary care doc. If they feel like you need to be referred to see us at the Hensley Center, then that's easier. You don't have to go through the emergency room for screening.
And then we have the great event coming up in October.
Right, absolutely.
And they can come and see about screening there and hear Dr. Foster talk. It's going to be a packed house, really excited, lunch provided. It's going to be big numbers. We're really excited about everybody coming out for that and being a part of that. And we just hope everybody will mark their calendar and be there for that. Again, you want to call and reserve your spot for that, just so we can get a count on lunch. So make sure to do that. And Dr. Foster, just want to thank you for being on Healthy Connections today. I wish you the best of luck, and we'll see you out at the event on October 5th.
Thank you, Tobias.
All right, thank you, and everybody have a great day.